Hello, dear students. You are welcome again to our next class. And in this class of the PHS 223 lecture note 2, we are dealing with the topic demographic features of the Nigerian population. Demographic features of the Nigerian population. You will remember vividly that the last class under lesson note 1 talked about introduction to demography and its relevance to public health. So today, we'll be seeing the following lesson under lesson note 2. We'll be discussing population size, composition, and distribution. We'll be discussing trends in population growth in Nigeria. We'll be discussing population projections and future trends, and then we'll conclude the course for lesson note 2. So let's go back and start our discussion. Remember, you are to listen, you are to take notes. Don't forget. Now, under lesson note 2, beginning with population size, composition, and distribution, we'll be looking at Nigeria as a case study, the features of Nigerian population. The Nigerian population size is a key demographic feature that greatly influences the nation's developmental challenge, or developmental challenges as it may. Not just one issue, there are many. As of 2023, the population stands at approximately 223 million people, according to the World Bank in 2023, making Nigeria one of the most populous countries in Africa and the 7th largest globally. And this massive population size places immense pressure on the country's infrastructure, healthcare system, and the public services. The increasing demand for basic amenities such as education, healthcare, housing, and sanitation becomes a more critical challenge for the government to address. And this explains to us the challenge of population size. Very serious. And it explains to us the demand on the government to be able to meet the needs of the people, the yearnings of the people, and to provide quality service for the people. So this is very, very sure. Okay, so let's continue. We'll be seeing the population size and composition as well as distribution under two areas. A, rapid population increase, that is population size, and 2, population composition. Now, under the rapid population size or increase, we see that the rapid population growth in Nigeria is characterized by both natural growth, that is through normal births, through births, and also migration. Now, the high fertility rates combined with relatively lower mortality rates create a population boom, that is explosion in the number of citizens, in the number of persons following the migration, following births. And this puts significant pressure on existing social systems. Then it requires forward-thinking strategies by the government or the health officials or the health ministers to ensure sustainable development in healthcare, urban planning, and social services. And so the great rate challenges the capacity of existing infrastructure to provide services to all Nigerians. And so we have to look at it and say, all right, in Lagos State, for example, we know the population in Amodofin, which appear to be one of the biggest local governments in the Federal Republic of Nigeria, and then in Lagos as a whole. And we have a lot of people living there. So how many public health centers do we have? How many good network routes do we have? How many universities or schools, we have? How many local governments, enabled access to facilities do you have there? So all these things we have to look at, because the population, as it increases, you don't say we have built two houses, we have built, 200 houses, we have built two public health centers, and we go to rest. Remember, the time you built them, the population is barely probably 100,000. And now, after 6 years, there have been geometrical rate of births, maybe scarce in few rates of death, and then migration in their hundreds. The population has increased. So more births will take place, more aged persons will be there, more young population will be there, and so we need those public health centers. Now, under population composition, we see the following. We consider population composition under the following. Number one, youthful population. Number two, age structure and population pyramid. So let's discuss it so that you understand the population composition very well. Now, under the population composition, we're looking at the youthful population. So Nigeria's population is notably young, with about 43% of population being under the age of 15, according to the United Nations in 2023, where that fact came from. And this age distribution has profound implications for the country's social policies, particularly in education, healthcare, and employment, because you have to cater for these young ones. The growing number of children and adolescents requires a strategic focus on enhancing education, infrastructure, and child welfare services to meet the rising demand. This is very, 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 very key. Now let's see the age structure and population pyramid. We have seen the youthful population. That tells us what the government is planning, because they have to cater for the increasingly number of youth in the country. Age structure and population pyramids. The age structure in Nigeria is often depicted using population pyramids. Now, what are pyramids? These pyramids typically show a broad base, which indicates a high birth rate, and a narrow top, reflecting the relatively low proportion of elderly individuals. So at the bottom, a lot of children is being born, and the children are growing up to become. So at the middle, you have youths in their numbers, and at the very top of the pyramid, like a triangle, you have the elderly in their few numbers. Remember, many of them are late, and a few of them are still alive. So the youthful population will continue to drive the demand for schools, healthcare for young children, and eventually job opportunities for the adult population as they age. However, take note, the narrow top also highlights the future challenges of an aging population, so which will need to be addressed in long-term care policies and elderly welfare systems in the coming decades. This is very, 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 very important. So, as we look at this, it will help you to understand how we intend to about that. So let's see geographical distribution. Geographical distribution. Under the geographical distribution, we'll be discussing it under urban-rural disparities, urbanization. So when you say geographical distribution, we have to look at the urban, rural, the difference between two of them, what separates the two of them. And then we look at the urbanization, where everybody is moving to. Now, under the urban and rural disparities, Nigeria's population is unevenly distributed across the country. And so you see that there's a huge gap. People are migrating to the urban, and when they retire, they become old, they migrate back to the rural area. Now, the southern regions, particularly urban centers like Lagos and Niger Delta region, experience much higher population densities due to better economic opportunities, infrastructure, and access to services. In contrast, the northern states such as Borno and Yobe have lower population densities. This uneven distribution exacerbates the challenges of providing equitable access to healthcare, education, and employment opportunities. That's why you have to allocate more of these facilities to those densely populated areas rather than the scarcely populated area. So the differences will be there. Now, rural areas tend to suffer from inadequate healthcare infrastructure, leading to higher incidences of preventable diseases and infant mortality. Now, the problem is during the allocation, probably it was not done or allocated the right way. It is supposed to still cater for both sides. That disparity is not supposed to be there. Those in the urban should have enough to take care of the population, and those in the rural should have enough to take care of the few or scarce population there, not neglecting them totally. Under urbanization, which is the second aspect, properly understand the geographical distribution, we will be seeing the rapid urbanization of Nigerian cities, especially Lagos and Abuja. This is another key trend. Now, you see that these cities attract migrants from rural areas who seek better economic opportunities, improved living standards, and access to modern amenities, internet, and so on. However, the rapid migration to urban areas have put tremendous pressure on infrastructure that are already in the urban areas, such as the housing, the transportation, sanitation, and healthcare. Urban slums have been seen to become a significant feature of major cities. So even in the urban, because of the pressure, you now have them looking like slums. Too many people around the place with less amenities. And the challenge is to accommodate these populations while improving living standards and ensuring sustainability. Now let's see number 2, the trends in population growth in Nigeria. Let's see the trends in population growth in Nigeria. Nigeria's population growth rate has inconsistently remained high. I will be looking at population growth rates, be looking at factors driving population growth. I'll be looking at impact of population growth. Impact of population growth. So it's important that we take time to understand this as we discuss. All right. Now, having said that, in terms of Nigerian population, we've seen the country's population has grown to such that it has more than quadrupled since the 1950s. Now, since it has quadrupled since 1950, that is, it has increased exponentially, largely due to high fertility rates and reduced mortality rates. This exponential growth is indicative of a population explosion, telling us that, look, there are more births, people are enjoying themselves, they are increasing in population. Where the rate of population increase far outpaces the country's economic development, you will now begin to see a lot of pressure in the infrastructure. Those days, there were enough schools because the populations were in there. But 10 years down the line, those schools were no longer enough. There were so many hospitals. University of Ibadan was the best. A lot of best could cater to people because the population wasn't that. Now, the population is very high, exponentially. And so University of Ibadan teaching hospital can no longer take everybody. You now have to have teaching hospitals in every state to be able to meet up the needs and demands on ground. Now, under fertility rates, let's see the impact of fertility rates as it affects trends in population growth in Nigeria. While fertility rates in Nigeria have gradually decreased over the years because of family planning control measures, they still remain above replacement levels. For example, around 5 children per woman as of 2023. Now you see this high fertility rate is influenced by social cultural factors such as the preference for large families, limited access to family planning services, and low levels of education by the parents, especially among women in rural areas. Now the country's fertility rate is still significantly higher than the global average. And you know what this means? It exacerbates the challenges of managing rapid population growth. That's the impact of fertility rates leading to trend in population. Let's see declining mortality rates. Declining mortality rates. When people are not dying and they will have increased birth rate, what happens? The population is increasing. Alongside high birth rates, improvement in healthcare especially maternal and child death, having contributed to reduce mortality rates, have enhanced access to vaccines, improved sanitation, and better medical care, and these have all contributed to an increase in life expectancy. All these things are now available, so it reduced death in greater level, and therefore you have a decrease in infant mortality as well. However, the growing population still presents significant hurdles in ensuring that the gains, the advantage, the facilities in healthcare becomes equitable and well distributed across the country. Remember, lesser people are dying because of the effort of the hospitals, the effort of the government, the effort of sanitation processes and programs, but more persons are given birth because of the good life, and then the population is increasing. Now let us see factors driving population growth. Factors driving population. We have high birth rates. High birth rates. I'm sure just saying that you know what that means. That is, the high birth rates in Nigeria are driven by cultural factors such as preference for larger families. Oh, the more children you have, the better for you. Go to farms and your children can do the harvest, they can do the planting and so on, compared to somebody who has only two children. Especially in rural areas where children are often seen as a source of support in old age. Additionally, we have limited access to modern family planning methods in those rural areas, coupled with limited public health campaigns. Nobody is going there to do a lot of talking, or few amounts or inadequate level of planning. Family planning is taking place. And this means that many women have more children than they might prefer because no proper family planning process. Now, let us see under the same factors driving population. After we have seen high birth rate, the next factor that is driving it is healthcare improvement. Nigeria's healthcare improvements, particularly in maternal and child health services, have been instrumental in reducing death rates, verbal vaccination programs, better access to clean water, and improvements in maternal care have lowered mortality rates, particularly among infants, mothers during childbirth. You no longer have mothers dying in the hospital because there is no nurse or there is no doctor. However, more work is required to reduce preventable deaths in both urban and rural areas. We are not saying it doesn't happen, but then it has reduced drastically, and that has also increased the population. The next one that causes population growth is the impact of the population growth itself. So let's see, the third one, apart from factors driving population growth, let us now see impact of population growth. Yeah, impact of population growth. That's the third one under topic 2. Now, increased demand for social services is number 1. That's number 1, impact. Increase demand for social services. Increase demand for social services. So when there's an increase in population, everybody is demanding for social services. The rapid population growth, compounded by the youthful nature of the population, has resulted in an increased demand for education, healthcare, and employment opportunities. Providing sufficient infrastructure and services cater to the growing population is a significant challenge. For instance, the education system is stretched as more children reach school age, and healthcare services are becoming overwhelmed by the rising number of people that require healthcare. Another impact of population growth is the urban-rural divide. One of the key implications of Nigerian population growth is the urban-rural divide in healthcare access. While the urban areas see more healthcare investment, people donate more, people go there to invest more in the hospitals, and a greater concentration of healthcare workers are there. They employ more, they post more health workers there. The rural areas lag behind in terms of access to medical facilities. And this leads to higher mortality rates, particularly from preventable diseases such as malaria, respiratory infections. Inadequate infrastructure in rural areas also hinder the implementation of public health programs, and this further exacerbates health disparity. So there's a huge gap between the public health centers in the rural and that of the urban. And so these are the impact of population growth. Let us see the population projections and future trend. We're looking at Nigeria now. The population projections and future trend. Now, there are projection methods that are used. Projection methods that are used. Now, mathematical models is one of them. We have the mathematical models. Several methods are used to project population growth, such as arithmetic growth method, geometric growth method, and exponential growth method. Each of these methods use different formulas to estimate future population size based on current trends of births, deaths, and migration rates. Now, exponential growth is often the most commonly used. Take note of that. Exponential growth is what the most often used or most commonly used model for countries with high growth rates like Nigeria. So take note of the several methods such as project population several methods such as the arithmetic growth method and geometric growth method, and also the exponential growth method. So those three you could be asked during the exam, and so it's very important. Now, what are the implications? The implications of these projections. What are the implications of these projections? Projections show that Nigeria's population is expected to continue growing rapidly, with estimates suggesting it could exceed 400 million by 2050. Now, imagine what we are now and compare it by 2050, which is about 25 years' time. These projections highlight the urgent need for robust policy interventions to address population-related challenges. Population growth, if not adequately managed, could outstrip the country's efforts in providing education, healthcare, and economic opportunities. And so, if we look at this projection, any good governance should look ahead of time and begin to understand that, look, with the way we are going, if currently we have, for example, in Amodofin local government, 18 public health centers, we are likely to divide the local government into new local governments, for example, to have more additional local governments with one public health centers in each of them, probably doubling the public health centers, increasing the road network, improving the educational facilities, employing more health workers, more educational officers, more public health workers, and so on. So this will be determined as an informed decision based on implications or based on projections that have been put on ground. Now let us see policy implication. I haven't talked about the projection methods. Let us see the policy implications. Now, sustainable development is key, because when you have a good policy implication, what it will bring about, what it will cause, is sustainable development. It will bring about sustainable development, no doubt about it. And why do we have the policy implication? Because when you have a policy implication as a result of good projection, it will give us informed based idea on how to go about particular issues. The government will not just be tackling it ignorantly. No. In the health sector, it will be informed based, with evidence, with figures, with data. And so to manage this projected growth, Nigeria needs to implement policies that focuses on sustainable development, whether the government is out or the government is in, or the policies or the health officials are changing, retiring. This sustainable development will be put in place by having good implementable policies. Now, this should include increased investment in family planning, improving access to quality care, and education campaign, especially for women and girls. Family planning initiatives are crucial, controlling the fertility rate, while better healthcare will ensure that reductions to mortality are sustained. We also have to look at the urbanization policies. The urbanization policies. As urbanization continues, there is a need for policies that focus on sustainable urban planning. These policies should ensure that infrastructure such as good road, housing, healthcare facilities, and sanitation services can accommodate the rising urban population. Additionally, there is a need for equitable resource distribution between the urban and the rural areas to be able to reduce disparities in healthcare access. And so, under policy implications, we have seen that managing this growth is essential for sustainable development, and it requires investment in family planning, healthcare education, and economic policies that can provide sufficient jobs and services for the growing population. And we have seen effective demographic policies which should address urbanization trends and ensure that the infrastructure and services can keep pace with population. This is very, very important, and I expect that you've taken good notes and you've listened carefully. We've come to the end of lecture 2, and so I want to encourage you, ask your questions on the Google Classroom comment section. When we meet in class, I will provide answers to all of them. Now, if you do not listen and take note, you have issues. And so it doesn't absorb you from taking notes. You have the material in front of you. All you need to do is listen, pause, take your notes, read, and then ask your questions. I will be there with answers at the right time while we meet in the classroom. So thank you and have a wonderful time learning. I'll see you in lesson note 3 when we discuss mortality, fertility, and fertility and migration. Bye.